Hi everyone, once again, welcome to Psych Watch. Today we will discuss about anxiety disorder, which is the most common problem faced by human being across the world. It is significant in psychiatric ward as well as in general wards. Many of these patients come to hospital with various physical problems. So once you analyze those physical problems, we will come to know that they are affected with anxiety disorders. So it's very important to identify people with anxiety disorder so as to manage their conditions effectively. So what is anxiety? So various definitions are there, various explanations are there related to anxiety. It's a feeling characterized by diffuse, unpleasant, vague sense of apprehension, often accompanied by autonomic symptoms. So it's a vague, unpleasant feeling which is accompanied by autonomic symptom. What are the autonomic symptoms that we may get? It can be headache, perspiration, palpitation, tightness of the chest, and mild stomach discomfort. So these are the common features we may get in people who are affected with anxiety disorder. Another terminology which is very much relevant while dealing about anxiety disorder is fear. It is a response to a threat that is known, external, definitive, or non-conflictual in origin. It's a threat felt by the individual towards an external, identified, definitive, non-conflictual in origin. That means which is actually present, the person is already experienced, and it is the response towards that particular stimuli is fear. Another terminology is pathological anxiety. When this anxiety is not possible to relieved with the help of normal defense mechanisms or coping mechanisms, it is known as pathological anxiety. So pathological anxiety needs immediate intervention, treatment, so that it can be controlled and condition of the client can be improved. Now let us see what are the epidemiological aspects related to anxiety disorders. The most common psychiatric illness is of course is anxiety or anxiety disorders, and it is a major cause of impairment and distress for individuals affected with anxiety. Yes, it is an important cause of impairment and distress for individuals affected with anxiety disorder. Mostly it's seen in women compared to male. And generalized anxiety disorder, panic attack, the percentage of individuals affected are 3 to 5%, whereas social phobia is seen in 13% of the population. OCD is seen, obsessive compulsive disorder, seen among 2 to 4% of individuals. Now we'll see what are the etiological factors or theories which explains about the etiology of anxiety disorder. Various theories explains about cause of this anxiety disorder, and first and foremost one is psychoanalytical theory. Then behavioral theories, biological theories, genetic theories, neurobiological theories, psychosocial theories, sociocultural theories. So these are some of the theories which explains about the etiology of anxiety disorder. Among this is psychoanalytical theory is the most commonest one, which explains about development of personality. According to Sigmund Freud, the part of mind is divided into three: its, ego, and superego. It is operated by pleasure principle. Ego is operated by reality principles, and superego is operated by morality principles. Whenever a person gets a chance to enjoy pleasure, its part of his mind will act. But at the same time, the morality parts or the superego will oppose that movement. So that means there is conflict between its and superego. Once there is a conflict, there is natural escalation of anxiety in that individual. Here comes the role of ego, which is operated by reality principle. So this ego defense mechanism come into play to counteract the effect of this anxiety development. For that, individual use various defense mechanism or mental mechanisms that will help the persons to avoid anxiety. And in pathological anxiety, this coping mechanism or coping resources, the defense mechanism won't work effectively, or can be a destructive defense mechanism may work. That will end up with a severe anxiety. According to this psychoanalytical theory, anxiety can be impulse anxiety, that is id anxiety, separation anxiety, castration anxiety, superego anxiety. Id anxiety, I told you, it is because of the conflict between id and superego. Whenever the person sees something, his id part will act to receive that pleasure. That is impulse type of behavior we can see. That is what is impulse anxiety. Separation anxiety is developing because of the separation from the child from the mother. When it becomes pathological, it can be separation anxiety. And during the developmental stage, that is in toddler period, there is possibility of development of, that is electral complex and Oedipus complex. At that time, there will be envy towards the opposite sex of their parents. That will end up with the castration anxiety. And last word is superego anxiety. It is because of the dominance of superego in the structure of that mind, which is dominating over the its, and that will end up with the superego anxiety. There are various neurotransmitters which is involved in anxiety disorders, and major neurotransmitters are serotonin, norepinephrine, and GABA, gamma aminobutyric acid. So these are the three important neurotransmitters involved in anxiety disorder. And any mechanism, anything happened in the brain that affects development of or production of or metabolism of these neurotransmitters will end up with anxiety disorders. And areas of the brain that is affected in anxiety are amygdala, which is very much affected, associated with the fear; hippocampus, which is also associated with the direction, relay station; locus coeruleus, which is involved in arousal part of brain; brainstem, which is involved in respiration and heart rate; hypothalamus, which is involved in stress response. Frontal cortex, which is involved in cognitive function, higher mental function. Thalamus, again, which is involved in sensory stimuli. And basal ganglia, which is very much involved in tremors. See, these are the part of the brain which is involved in anxiety. So from it is clear what all symptoms a person can have if he is affected with anxiety. Now we can move on to classification of anxiety disorder. According to DSM and ICD, DSM means Diagnostic and Statistical Manual, anxiety disorders are classified as panic disorders with agoraphobia, panic disorder without agoraphobia, agoraphobia without a history of panic disorder alone, that is agoraphobia alone, panic disorder alone, panic disorders and agoraphobia. Then another type is specific phobia, social phobia, obsessive compulsive disorder, post-traumatic disorder, acute stress disorder, generalized anxiety disorder due to general medical conditions, substance-induced anxiety disorder not elsewhere specified. Among this, post-traumatic disorder and acute stress disorder we will discuss in another video. Rest we will cover in this one. According to ICD, there are little bit difference compared to DSM. ICD, International Classification of Disorders by WHO. These anxiety disorders are coming under phobic anxiety disorder, other anxiety disorder, obsessive compulsive disorder, reaction to severe stress. In phobic anxiety disorder, that is F40, agoraphobia without panic disorder, with panic disorder, social phobia, specific phobia, obsessive compulsive, other phobic anxiety disorder unspecified. In other anxiety disorder, it comes panic disorders, generalized anxiety disorder, mixed anxiety disorder, depressive disorder, other mixed anxiety disorder, other specific anxiety disorder unspecified. F42 group comes as obsessive compulsive disorder. In that, predominantly obsessional thoughts and rumination, predominantly compulsive acts, mixed obsessional thoughts, other OCD unspecified. So these are the general classification. Two types of classification, that is ICD classification and DSM classification. Interesting factor among this classification is anxiety can lead to panic attack can lead to depression. This depression in turn can affect more anxiety. This more anxiety can lead to more panic attack. It can lead to more depression. So depression and anxiety is always coming in together, and it is very difficult to differentiate some of the symptoms. Person can come with depressive symptoms. Actually, it can be anxiety disorder. In some situation, patient can come as anxiety symptoms, but it can be depression. So always there is overlapping between depression and anxiety. We'll see generalized anxiety, GAD first. It is characterized by chronic, unrealistic, excessive anxiety and worry. 2-3 terminologies are there which is very significant while discussing general anxiety disorder. It's a chronic one. It will take some time to develop. Unrealistic. The person may have unrealistic response towards the stress, which cannot be explained anyway, and it is excessive anxiety and worry. The person may be experiencing that much anxiety. He may not withstand. He may not do the activities of daily living effectively. So that is what is generalized anxiety disorder. And various clinical symptoms we can see, symptomatology, worry, apprehension, psychological arousal. That means the person may have that old psychological thoughts, negative thoughts, hopelessness, everything can be there because it is overlapping with depression. Automatic overactivity, that is very important. That is, person may come with physical symptoms, excessive physical symptoms, increased pulse, increased respiration, perspiration, palpitation, increased heart rate. So all this overactivity can be there in patients with this generalized anxiety disorder. Muscle tension, he may be coming with that. Hyperventilation because of the tachypnea, person may develop hyperventilation. And many cases, sleep disorders or sleep disturbance can be seen. So these are the clinical features associated with the generalized anxiety disorder. Now we'll see some of the physical effects of anxiety disorder. Most common one is sweating. That is very common one. Once you are anxious, you will have a profuse sweating. You may have feeling of tightness in the chest. Sometimes patients can come with a chest pain. It can be because of anxiety. Person can come with dizziness, decreased sexual drive, irritability, confused. Most of the time that is muscle tension can be there. Regarding heart rates, increased heart rate, increased breathlessness, palpitation. So if you assess BP, you may get hypertension. And many a time patient can have nausea and diarrhea. So that is the most common symptom that we can see in patients with anxiety disorders, especially generalized anxiety disorder. Here the sufferer must have primary symptoms of anxiety most of the days in a week, and it can prolong up to 1 month or months. Most of the time person is affected with these symptoms. Apprehension, worries about future, always thinking about misfortunes. Oh my God, I couldn't achieve anything in my life. That hopelessness, worthlessness, everything can be feeling of on an edge, losing his control. Patient can have motor restlessness. Patient can have tension headache. He may not be able to sleep. He may not be able to relax. And motor activity is related to lightheadedness, profuse sweating, tachycardia, tachypnea, dry mouths. In children, frequent need for reassurance. If this condition is affecting children, they need reassurance. That is also there. Once a person is coming with these many symptoms, will we be able to treat that individual as an anxiety disorder? No. There are physical illness which is very much have the symptoms which is similar to that of this generalized anxiety disorder. So we should have that differential diagnosis properly. I already told you, depressive disorder is a major thing that can mimic similar symptoms. So first thing is you have to differentiate depression. You have to differentiate schizophrenia, that we already learned. Various schizophrenic symptoms are there which can have similar manifestation. Dementia, if your client is an elderly one, he may show some similar features. It can be because of dementia. substance withdrawal symptom. If a person is misusing some abusive substances, psychoactive substances, he may show similar symptom. If he is not getting, that is withdrawal symptoms with this abusive substance. Interestingly, there are many physical illness which can have similar symptoms. And anxiety can be secondary to symptoms of physical illness. That is also a considerable one. Many a time, GAD can be mistaken with a physical illness also. So one must be very much vigilant while assessing a person with this generalized anxiety disorder. Now we can see panic disorders. It's a sudden overwhelming feeling of terror or impending doom. The person may feel something is going to happen in his life. He's going to die. He is losing his control. It's a chronic and recurrent illness associated with a significant functional impairment. A significant functional impairment is associated with this panic attack, and it can come on and off. That is also important. So regarding the clinical features of this panic attack, the person may have palpitation, increased heart rate, or accelerated heart rate. He may have profuse sweating, trembling or shaking, not able to maintain normal physical functions, sensation of shortness of breath or smoothing, feeling of choking, not able to breathe properly, chest pain, chest discomfort, and nausea, abdominal cramps, diarrhea, abdominal distress. These many symptoms a person can have if he is affected with a panic disorder. Plus, he may have fear of losing control. He may think that he is going to die. He may have derealization. That means he cannot realize what is happening in and around him. He himself feels that he is not existing. Sometimes he will see that this world is not existing. Hot flush, tremors, all these things can happen when the person is affected with a panic disorder. Here also very important to have differential diagnosis, because cardiovascular disorders can have similar manifestation. Pulmonary disorders can have similar manifestation. If your patient is affected with the problems of CNS, he also can have similar manifestation. If your patient is affected with the endocrine disorders, he may have these similar features. Drug intoxication, substance abuse disorder, drug withdrawal, substance abuse withdrawal, your patient can have similar symptoms. So always remember to differential diagnosis. Before treating a patient as panic disorder or panic attack, please remember to make this differential diagnosis, because all these features, all these disorders may have similar features. Now next one is phobic anxiety disorder. That is another common one associated in this group, that is anxiety disorder. What is phobia? Here the person may have irrational fear, which may result in conscious avoidance of that specific situation which he is feared of. He may avoid that specific objects which he is feared of. He may avoid that activity which he is feared of. That is, please remember that fear is irrational. If your patient is affected with irrational fear towards an object, a situation, or anxiety, he will consciously avoid that particular situation, activity, or object. That is what is phobia. That fear may be excessive, that he cannot control himself. Only thing what he can do is he will avoid that one. So that is in specific phobias. According to DSM, this phobia can be of animal type, phobia towards animals. It can be phobia, the irrational fear can be against natural environments. It can be blood type, it can be situational type. Anything can be there. Situation, activity, or object. Now we'll see some of the common phobias which is very much seen among our population. First one is acrophobia. The person may not be able to climb to the top of a tree. He will fear of heights. If he is feared of cats, that is what is known as ailurophobia. Cats, it's a normal thing. It won't cause any problem. But for him, it is the cause of fear that he will avoid that. He will try to avoid that one. Another one is pain. The phobia associated with the pain is known as algophobia. That means the person is feared of pain. He will avoid all situations that may cause pain. For example, injections. They will not accept injection. They will do whatever they want. At any cost, they need to avoid that pain. Another one is flowers. It is known as anthophobia. Can you believe that one? People are affected with the fear of flowers. Then people are feared of people. That is what is known as anthrophobia. They cannot mingle with the people. The socialization of such individuals are affected badly. There are people with a phobia towards water. That is what is known as aquaphobia. Aquaphobia. Fear of water. Then people are with the spiders. Fear of spiders. That is known as arachnophobia. People are affected with lightning. Fears towards lightning. That is known as astrophobia. People are affected with the fear of needles. That is one is known as balloniphobia. Balloniphobia. Then brontophobia is there. That is fear towards thunder. And important one, next one is fear of closed space. That is what is claustrophobia. Such people may not be able to enter into a lift. They will avoid that situation. Then cyanophobia. People are affected with such cyanophobia are feared of dogs. People are with fear of horse. That is what is known as echinophobia. Then people are having hematophobia, blood. People are affected with water, the hydrophobia. People are affected with monophobia, that means fear of being alone. Pyrophobia, fear of fire. Thanatophobia, fear of death. Trichophobia, fear of hair. See, a number of phobias are available. You need not to remember all, but you should remember few of them, because that is commonest one you need to remember. Then social phobia, we will see what is social phobia. In social phobia, the person may have a persistent fear of social situations in which embarrassment occurs. He will not be able to go to that social situation because it is embarrassing for him. He will avoid that situation most of the time. Whatever may be the specific phobia, he may have anxiety. As a result, they will avoid that situation, try to avoid that situation. In many cases, they will have situation anxiety plus anticipatory anxiety. That is very interesting. So I can anticipate that if I do like this, at this time I may have to face that one. So based on that, I will have anxiety now. That is anticipatory anxiety. So in clinical picture that also you may come to know. Next important anxiety disorder is obsessive compulsive disorder. From the word it is clear, obsession is there, compulsion is there. Obsessive thoughts and compulsive acts. Obsession is thoughts, compulsion is acts. Obsessive thought means it's an intriguing and often debilitating syndrome characterized by the presence of two distinct phenomena, obsession and compulsion. In obsession, the person may have unwanted thoughts or images that is intruding to the mind that will cause anxiety. That thoughts can cause impulses or images that can cause anxiety. Continuously the person is getting that thoughts. Continuously the person is getting that image. There was one patient in our hospital. He was not taking baths. So once the psychiatrist did this detailed assessment, then he found that he is not going to bathroom because he is seeing these images, naked images on the walls of that bathroom. That was the reason he is not going for taking baths. It's a type of obsession. The person can have obsession that his hand is contaminated. So what he will do? He will do washing in order to remove this contamination. If he is not doing that action, the anxiety will escalate. So once this obsessive thoughts are there in the mind, they will go for compulsive act, repetitive compulsive acts. So that is what is compulsion, unwanted repetitive behavior pattern or mental acts. People can have repeated prayers, compulsive acts, repeated counting. They think that the number which is having, the number actually what is having with him is not there, so they will repeatedly count. They may repeatedly repeat the word silently, because their obsessive thought is that they will forget the word, so they will repeat that word. So that is also seen in patients with obsessive compulsive disorder. Now we'll see what are the clinical features or clinical picture of a person with obsessive compulsive disorder. Person can have obsessional thoughts. Then people can have obsessional rumination. Repeatedly they are taking a past event and repeatedly thinking about that. Obsessional rumination. Then obsessional impulses. They want to do something regularly. They cannot control their acts. That is, repeatedly they want to do something. That is obsessional impulses. Obsessional rituals. Doing some rituals repeated again and again. Obsessional slowness. Another important thing. The person will do this activity very slowly. They will not complete the task effectively. And obsessional phobias, anxiety, depression, depersonalization. So these are the clinical picture you may get for patients with OCD, obsessive compulsive disorder. And clinical syndromes in obsessive compulsive disorders are washers, checkers, pure obsession, primary obsessive slowness, washers repeatedly washing hands, checkers repeatedly checking their numbers, contents. And various tools are available for patients with this obsessive compulsive disorder. And famous one is A. Brown obsessive compulsive scale. You can use that scale to identify whether these features are suggestive of obsessive compulsive disorder for the clients. Then compulsive activity checklists are also there, CAC, that it can be used for identifying such situation or identify obsessive compulsive disorder. Another important anxiety disorder is body dysmorphic disorder. Here the person will feel that a particular part of the body is not according to that regular shape and all. There is dysmorphic fitting of some body parts. So they are more concerned about that figure of their body and they will have anxiety. Trichotillomania, here the person may have pulling out of hair. Then hoarding disorder, here the person may keep certain objects which is irrelevant, but they will keep without knowing it is useless. They may consider it as a useful thing, and they will keep this one for a long. That is what is hoarding disorder. Now we'll see management. In management, medications that is very much used are benzodiazepines, anti-anxiety drugs. Antihistamines are found to be effective. Then antidepressants are found to be effective. Antihypertensive are effective. So these drugs can be prescribed for this condition. In nursing management, we can have assessment, detailed assessment, subjective and objective data. Differential diagnosis is very important. Clinical symptoms, what are the problems patient can have. Subjective and objective data is important. Then we can have diagnosis, nursing diagnosis. Important nursing diagnoses are anxiety, fear, powerlessness, social isolation, ineffective coping, ineffective role performance, disturbed body image, ineffective impulse control. So these are some of the common nursing diagnoses that can be used for patients with anxiety disorder. So what we can plan and implement? Individual psychotherapy is effective. Cognitive behavioral therapy can be done. Behavioral therapy, systematic desensitization, flooding. So these are some of the behavioral modification or psychotherapy that we can apply for such patients with these many anxiety disorders. As I told you, antidepressants, carbamazepine, benzodiazepines, antihistamines, antidepressants, mild antipsychotics, antihypertensives are also found to be effective. Then psychoeducation. Client and family education is very important. Here we can have education or psychoeducations regarding what is anxiety, what is OCD. We can teach them what is body dysmorphic disorder, what are the medications used, what are the effect of medication, what are the side effects of medication. All these things we can have. Then we can teach them stress management. In that we can have Jacobson progressive muscle relaxation technique, JPMR. We can have guided imagery. We can have thought stopping techniques. We can have music therapy. We can teach them meditation. We can teach them yoga. We can teach them physical exercise. All these are found to be very much effective for patients with anxiety disorder. Then finally, in nursing management, we should have that evaluation, and it will take time. It is very difficult to control within a short span of time, because it's a behavioral modification what we are expecting. Along with the medication, we can have supportive psychotherapy, psychoeducation, and gradually, step by step, we can control these symptoms. These type of disorders are very important, very significant, because number of people affected with these symptoms or these disorders are very high. And interestingly, many are not coming to the forefront for getting treatment because they are unaware. Their family members are unaware. They will think that this is normal part of their personality. One interesting thing is, if we could identify such patients in early stage, we can manage their problem. We can control their problem. And it will definitely improve their quality of life, their family members' quality of life. So by this, we are ending this anxiety disorder, which you can expect one short note from this area. If you have any doubts, you can comment or call me. Thank you.